Good afternoon, everyone. We'll get started in a few minutes.
Hello, everyone.
Good morning. I guess good afternoon.
Yeah, good afternoon.
Hello.
Hey, Jeannie, good to see you.
Hi, David. Good to see you. How are things going? How are things going, David? Hi.
Hey. Well, it all came together.
Yes. Casey, you have quite the gorgeous view there.
Yeah, we have a little bit of Bicentennial Mall downtown on our windows.
Hey, Jeannie, I was just gonna let you know, you should be able to share. I don't know if you plan on sharing your screen at all, but you should be able to if you need to, but.
Okay, thank you. Yeah, I don't think I have anything to share today, but thanks.
Oh, did I pause? Was that me?
I don't know if it's a bad thing that it's a beautiful day outside and we're all in behind the computer, or is it a good reminder that air quality and asthma is important so that we can enjoy being outside?
I found an excuse earlier just to go run an errand so I could be outside.
You guys seeing my slide? Okay, good.
Yes.
Got so many screens going on, so just wanted to double check. We'll wait another minute. I will write at the top. Just one more minute.
We're waiting for a few more people to join. I'll just say thank you for everyone taking the time to out of your schedule to trust us to give you some good information. I already see we're over 30 attendees, so that's awesome.
Well, I can, while we're waiting for a few more people to join, I can go ahead and do a little bit of housekeeping, just so everybody knows, we are recording this today, this meeting. So just so you're aware, it's being recorded. We'll send out the recording afterwards. And then also we hope to have it posted eventually on our TDH website. So just be aware. And then also, I see most people are muted, just so you know. Just try to keep yourself muted. You can come off mute if you want to share any thoughts or have questions, but we'll have a time for that at the end. If you have comments or questions while people are speaking, feel free to use the comments section or the chat box and leave your questions there. We'll make sure I'll keep an eye on that so that nothing is missed. And I think it's slowed down a little bit. I think a lot of people are on, and so we want to be respectful of your time and go ahead and we'll get started. Welcome, and I'm going to let David do a big welcome. But just as we're kind of all on here, you're probably wondering who else is on here. Let me. Well, David, do you want to go ahead and take it away, or do you want me to share?
Go ahead. So, yeah, we'll have 4 checkpoints throughout the year 2024. So you can expect more information from us. Again, May 9th, August 8th, November 14th, all will be at noon Central Time. In those interims, if you have need to communicate with us, eep.health@tn.gov is the right email address, and all of the information, including the registration links, because they will change from meeting to meeting, will be on our Healthy Homes website, tn.gov/healthyhomes, and then just click on the asthma and you should find the information there. I want to show you yeah.
Oh, yes, great. I was just going to share, I know we're going to have a time for everyone to chat, but as you registered, you may have noticed we asked a lot of questions. We definitely want to have a good representation during these meetings. And just so you know, for our first meeting, we have 5 different counties represented and people from different counties joining. Backgrounds range from healthcare providers, nonprofits, academic institutions, and government, both city, kind of local and state government. And then as far as what you all do ranges, and so I'm excited to have you all here, but we have everyone from school health coordinators to epidemiologists, pulmonologists, and program managers, even air quality technicians. And so it's a great group of people. So thank you guys so much for joining. Okay. Well, and David, I think you're on. Do you want me to stop sharing so that you can share?
I just keep sharing. That's great. It works
Okay.
well this way. All right.
Sure.
So good afternoon. For those who don't know, my name is David Borowski. I've been with the Tennessee Department of Health for about 20 years and part of the state's environmental epidemiology program. I know that I've met many of you over the years working on Clean Air Month or a part of the Nashville Health and Wellness team, maybe Walk to School Day, and certainly a lot with the Tennessee Asthma Coalition, doing a wide variety of asthma events and awareness campaigns over the years. And so it's nice to see those who I've met before, and welcome to anybody who's new. As you saw from the folks who registered, we have a wide variety in the audience, and we're going to aim to try to bring everything about asthma that's happening in Tennessee to this place 4 times throughout the year, to give you a way to have a network of people who are working on asthma. So again, we're glad to have you. If you are interested, we have the chat open. Feel free to put your name, your organization, and anything about you, your contact information that you would like us to have, that we can then keep in case other people have questions or who else was on the call, those kind of things, ways to get back to you. We would really enjoy having that. It will help us figure out who the audience is and give you an opportunity also to use the chat to give us feedback and let us know what kind of topics you would be interested in for our future meetings. And again, for after today, you can use the email eep.health or call 615-741-7247, which is the main health department number. And we will get back with you. Of course, all of this again is on tn.gov/healthyhomes or Healthy Homes website. So what we do today is build on previous asthma awareness events and efforts that have happened in Tennessee over the last number of years. And so again, we'll have meetings today, May 9, August 8, November 14th, to provide you online learning options and networking for all things asthma in Tennessee. Basically, what I want to offer you is the stability of government to provide a home for asthma resources and conversation. You might call it a professional social networking. We're going to use our Healthy Homes website as the home base for registering and providing the recordings from these webinars. You'll learn that today the health department has a new health data website and has resources for asthma, asthma data and asthma reports ready for you to look at, and we have more planned. I won't spoil that surprise here in a moment from Rachel, but it'll be ready for you to use and interpret the asthma information there as of today. And getting ready for today, I talked with some different asthma coalition leaders, including Janine from Belmont, Natalia from Vanderbilt, and they were both gave me some guidance on kind of what to do, provided the Asthma Coalition contact list that we use to kind of shamelessly promote this opportunity. So to wrap up, hope this simple goal to reach each of you and give you some opportunities to network with others about asthma is useful from your Tennessee government. We're planned to have somebody speaking from government and outside of government at each of the quarterly webinars, and also give you opportunities to ask questions and provide feedback. And we'll hope to make your time worthwhile so you can connect with others, learning all about asthma, and then give us feedback for future meetings. Let's show a few more pictures. So that's Walk to School Day for people who did Walk Nashville Week back in the time. So this would have been one of the asthma flag days, the EPA Air Quality Asthma Program that the American Lung Association and Tennessee Asthma Coalition helped provide with Metro Health. And it's wanted, but keeping with the Super Bowl recent weekend, we did some Titans fans walk to the game day in the past. And the next picture, the look on people's faces when we told them that they were walking approximately 1 mile from where they parked to the stadium. And they're like, well, what else could we do? We have to walk. You can't park close. And so anyways, we gave them a sticker. We celebrated and we put up a big thing on the Jumbotron to encourage people to be thoughtful to physical activity and clean air. So thank you. Again, feel free to use the chat. We'll moderate that, and I'll turn it back to Angel to get our first speaker. Come off mute.
I apologize. All right. Well, I thought we have our first speaker sharing, and that's Rachel Weaver. She is with the Environmental Epidemiology Program and Health Tracking, and she has some information to share with us about asthma data. So I see your screen. Rachel looks great.
Yes. Good morning or afternoon, everyone. Can you guys hear me and see my slides okay?
Yes, we can.
So good afternoon. My name is Rachel Weaver, and I work in the Environmental Epi program at TDH. Today, my goal is to give you an update where you can find different types of publicly available asthma data specific to Tennessee. I am part of a team of environmental epidemiologists working on a grant from the CDC called the National Environmental Public Health Tracking Grant. This is a 5-year grant that Tennessee won in 2022, where we collect and analyze data for multiple chronic diseases and environmental factors. Asthma is one of the nationally consistent data measures that CDC tracks. Every fall, we submit the latest year of asthma hospitalization and emergency department visits that we get internally at TDH from the hospital discharge data system. CDC posts Tennessee's data along with all other 33 participating states to this website. The timing of Tennessee's joining the tracking program coincided with the idea to launch a place to store and display health data. Grant requirements of each state having a designated space to show data justified moving forward with the health data website. With the help of Tyler Tech, we built a brand new one-stop shop data site to store and display our data. Now the public will have a designated site to visit for all their health data needs. This is the homepage. So as you can see, under feature content, we have a link straight to the tracking website. To find asthma content or data, just browse by topic and chronic diseases, or click on View All Data to see it displayed in a neat catalog format. Follow this link to reach our data website. When you click on View All Data and search asthma, this is what you will see. All asthma pages are categorized by type. The news article icon represents a story page. The Rubik's Cube will be a data set, and the paperclip denotes a report. So currently we have 3 story pages with data visualizations and links to additional asthma data sites, as well as 6 asthma reports. We have 8 data sets uploaded for the years 2019 and 2020, but they are still private until we have them approved by data governance. This will be available no later than our next quarterly meeting. The graphs you see represented here are part of the dashboard that I'm currently working updating for years 2017 to present. The public will be able to use these visualizations to compare the state rates to county rates over time. So here you can see that Anderson County on the left had a lower rate over time than the red line, which represents the state rate, whereas Shelby County had a much higher rate of asthma compared to the state. So as we are working behind the scenes, we encourage you to visit the CDC's tracking website to get the most up-to-date Tennessee asthma data displayed in maps, charts, and table form. Just go to this website and click on the Explore Data button. Then you can filter by asthma, geographic type, year, and then select one of the more advanced options. Asthma Emergency Department visit data set is very robust. So if you visit the CDC, you can filter the data down to a granular level. Here's an example of rates broken down by county, age, gender for emergency department rates in 2019. While we report rates based on hospital discharge data under the tracking program, within the Division of Population Health Assessment, asthma data is reported in a different way using BRFIS. BRFIS stands for the Behavioral Risk Factor Surveillance System. It's the world's largest telephone health survey system. This means BRFIS data is self-reported. BRFIS has a tool that conducts real-time state-level data analysis. BRFIS is the source of prevalence data in Tennessee. The Chronic Disease Indicator tool is also a source for more specific asthma data. And these links can be found on our asthma story page on the Health Data website. Okay, so let's do a quick exercise. Look at these rates Which one do you think was the rate of asthma in Tennessee in 2020? A, B, C, or D? I realize there's not much context, but just take your best guess. You can write it down or just make a mental note. Okay. Did anyone think it depends? All of them could be an asthma rate? If that's what you said, you would be correct. Because as you can see, we have asthma emergency visit rate, then the hospitalization rate, and finally prevalence of those currently diagnosed with asthma, as well as those ever diagnosed with asthma. I just show this to point out how asthma is reported in various ways, depending on the source of the data. Let's see. You might ask why there is such, oh wait, that's not the right one. There we go. You might ask why there's such a lag on data being released. As I'm sure you can all appreciate, there are many steps that have to be taken before we can safely display this data publicly. Some of the challenges we have run into are small case size and risk of re-identification. There's a data governance team within TDH that has a scoring system to decide if data is too sensitive to display. So the data you have been used to seeing in the past may or may not be the way you begin seeing it moving forward. So currently our data that we can make publicly available is limited, but we're working on this. We are discussing internally how to make more data available for professionals such as yourselves to be able to use while still avoiding these privacy risks. So these are some potential solutions we are considering. In the case of asthma, we can widen age groups, geographic areas, and even combine years. Other solutions will, in all honesty, be driven by demand. Therefore, we won't be offended if you give us feedback that you would like to see more data displayed. We could use that as justification to put certain data out to the public if it could have a greater impact on making our state healthier. So this is a snapshot of 2020 data for the whole state showing different breakdowns. As you can see, there could be an argument to dig a bit deeper into these data sets to focus resources for asthma on certain populations or geographic areas. Emergency department rates are higher in the younger population, and when it comes to race and gender, the rates are disproportionate. As for hospitalizations, which are always much lower than emergency department visits, the rates among age are not as varied, but we are still seeing wide differences when we compare rates by gender and race. As of 2021, Tennessee was ranked number 10 for mortality rate from asthma in the United States. This is just another example of why it is important to have the most current data for our state publicly available so that we can work together to lower these rates. So just to recap, Tennessee's Data Health website is Tennessee's own one-stop shop housing data sets of hospital discharge data. An asthma Tableau dashboard will be live by our next meeting with the most up-to-date data. In the middle, you'll see the environmental public health tracking site. And this is where we currently submit our data each year. And it has publicly available data up to the year 2019, comparable to the other 3 participating states. And finally, on the end, the behavioral risk factor surveillance system, which is self-reported, and on their site, you will find calculated prevalence rates for asthma. This data is also the most current data that is out there. So now that you know where to find different types of asthma data, we would love to hear what you would like to see as we continue to build our health data website. Thank you for your time.
Thank you, Rachel. feel free, guys, to leave comments if you want to share. I know Rachel asked if you are using this data or how you utilize any of this data she mentioned from our Tennessee health data tracking or the CDC tracking, the BRFIS, anything if you want to share, we'd love to hear. It's good to get some feedback on how you're utilizing the data, or any questions for Rachel as well. All right. All right. Okay, thank you. Got some people sharing. I know Kathy asked, would we be able to break down the information by zip codes with the highest prevalence in Tennessee?
So there is part of the tracking is that they are going down to this the census level in some cases. That's optional for us to submit at right now. Again, it's sort of the timing right now is we are discussing with data governance about what level of discreteness we can go down to. I have a couple of my coworkers on there. I, I we break it down by county, but I'm not sure if with our governing rules if we could get it down to zip code. But again, that's something that we're going to discuss. It looks like
Yeah,
Kendra, my
Kendra,
coworker, might be able to.
yeah, do you want to share, Kendra? That's great if you want to
Yeah,
share.
I was gonna say that CDC was coming up with some guidelines to in the future at some point at least get it down to the census tract level. I think they said the zip code level will be a little too specific. So they were discussing some census tract identification, but I think that's a ways away for right now.
Yeah, so it sounds like right now there's the county data. Sorry, David, were you going to share?
Yeah, definitely right now it's county level data. We may be trying some tricks like some color pleth maps where we won't have outlines for zip code or census tract, but we may be able to kind of blend colors to show which ones are the hot spots. And there's maybe things like that that we can do in the meantime if this is something that's needed by folks without going through a full data use agreement. There is a way to get more specific data with the formal data use agreement and potentially an IRB, internal review board thing, but that's going to take a long time and a lot of paperwork. So we'll try to find some ways to visualize data that is still acceptable for our current governance standards. Thanks for that feedback.
Any other questions or thoughts on how you can or have been utilizing data? We'd love to hear it. Larry, I saw your comment about air quality, and I would love if you can hang on, if you're able to hang on till the end of the meeting. We've got two other people to share quickly, but I'd love to have you speak for a minute and share this information maybe at the end, if that's possible.
No problem at all. I can do that.
Yeah, great.
All right, thanks.
All right. Well, if there's no other questions at the moment, we'll keep moving on. I've got up next, I have the Amanda Johnson with our education department is going to share. Amanda, welcome.
Hey, good afternoon, everybody. I am Amanda Johnson. I am the school nurse consultant at the Department of Education in the Division of Coordinated School Health. And really what that means with my role, I work very closely with all 147 of our school districts as it relates to the delivery of quality school health services, and work very closely with all the district lead nurses or school health supervisors in each district. And I'm going to share just a few data points from last school year's annual health services report. And we obtain this data from an annual health services survey. It's actually statutorily required. And through the report, we submit that to the governor and General Assembly by October 31st of every year. And we report on various health related factors such as common chronic health conditions in the school setting, medication administration, as well as some other important data points. So regarding asthma, we ask school districts to report on the number of students diagnosed with some of the most common chronic health conditions. And so with asthma in the school setting, it is our most common physical health condition. And we do ask districts to only report on confirmed medical diagnoses. So in the past, we have asked them to also report on self-reported asthma diagnoses. And we decided a few years ago to remove that. We felt like from the state perspective, we were running into a lot of issues, a lot of over-reporting. And for our purposes for the report, we really only wanted to capture students that were receiving nursing services related to their asthma diagnosis. So when we're asking for a confirmed asthma diagnosis, that either means there's confirmation from a healthcare provider, whether it's a statement or a diagnosis code, or if they have an inhaler in the school setting or receiving medication related to their diagnoses. And so with that, the number of students diagnosed with asthma in the school setting is just under 34,000 for the 2022-2023 school year. It was actually 33,780 students that were diagnosed with asthma. And then we also capture a number of students that receive complex medical procedures ordered by their healthcare provider. And so we do capture a few procedures related to asthma. So we ask about oxygen saturation. So number of students for those was just under 13,500. We had 13,367 students that received that their O2 sats were checked at least once during the school year. And one thing that's important to note with these couple of data points I'm providing is that, again, we're asking for number of students, not number of times that that procedure actually occurred in the school. So it doesn't matter if the student had their O2 sats checked once or every day or whatever that looks like, we're still only capturing that student one time. And then we had for number of students that received nebulizer treatments in the school setting, we had 961 students. And then for peak flow measurements, we had 146 students. And then students that received oxygen in the school setting last school year, we had 47 students that were reported for our public schools. And then we do ask a couple questions about medication administration. So one of the questions we ask is number of times albuterol was administered in the school setting. And so a little different than that last data point where we were asking about number of students. For this one, we are asking for the number of times albuterol was actually administered. And we capture that for prescribed albuterol. And then we do have a handful, a few school districts that actually have stock albuterol that they provide for their students with a standing order from a medical provider. So the number of times prescribed albuterol was administered last school year was 22,838 times. And then for stock albuterol, it was 476 times. We also capture a couple data points related to absenteeism for certain chronic health conditions. And so it's a district decision whether or not districts collect data points related to chronic health conditions for asthma, or I'm sorry, for absenteeism. So we had about 47 school districts that tracked absenteeism rates related to asthma. And of those 47 school districts, they were actually reported 297 days absent related to an asthma diagnosis. And so that's all the data points we capture. If you're interested in learning more about those, or even some of the other chronic health condition data points we capture on the annual report, I'll drop the link to that in the chat. And let me know if you guys have any questions related to that.
Yeah, I thank you so much for all that information. And if you can share that link, that's some really great data. There is one question. Lynn Dawson once wondered about your asthma action plans and how you utilize them in school.
Yes, so students with chronic health conditions that have the potential to result in an emergency, like with asthma, should have an emergency action plan in the school setting. And what that really is an emergency plan for the non-medical staff in the school to know what to do during those emergencies. So for asthma, it would be, if you see these symptoms, then we do this, like administer, the rescue inhaler. And so that is also for asthma referred to as an asthma action plan. And schools and school districts absolutely utilize those for their students.
Great, thank you. And I see your link for that report. Any other questions? It sounds like your nurses are doing a lot of work in the schools. So yeah, sounds like you guys are busy. Thank you so much
Yes,
for
and
sharing
I'll
all of
because you
that.
said that, I'll throw out one other data point that some of our folks on this call may not be aware of. So, thanks, Lynn, for bringing up the asthma action plan because it is particularly important for schools that do not have a school nurse, right? Those non-medical staff need to know what to do during an emergency, and we still have about 30% of our public schools in Tennessee do not have a full-time school nurse.
Well, thank you. Thank you so much. So if you guys have questions that you think of for Amanda, feel free to still add those in the chat. We'll have a time here in just a little bit after our next presenter to have more questions and a conversation. Yeah, definitely. Lynn added that her hat is off to the school nurses. I agree. Yes. They're handling a lot, from asthma attacks to loose teeth falling out. So they're busy people. Okay, great. So we're going to go ahead and move on. We have one more speaker that's going to present. Meetu Patel, and I apologize, I am probably mispronouncing your name, but Meetu is from the Asthma and Allergy Network, and we are happy to have you on.
Thank you so much, Angel. And no worries, you pronounced it correctly. I'm totally fine.
Okay, well, good. Well, welcome.
And
Thank you so much for joining.
thank you so much. I do have some slides prepared, so let me just pull those up. Just give me a second. Teams is not behaving for me.
That's okay. That's all right. Let me know if you need any assistance, but
My apologies about this. I have the window open, but it's just not coming up in my share tab. Oh, there we
yeah.
go. There we go. Finally.
Looks good.
Thank you. All right, so hello everyone. My name is Meeta Patel, and I am from Allergy and Asthma Network. I am AAN's health data analyst, as well as the project lead for the management of the Asthma Equity Explorer, AEE database as we know it, that David and his team kindly invited me to speak about today. Before we start off talking about the database, let me provide a small snippet about Allergy and Asthma Network. AAN is a leading national nonprofit organization, and for the past 35 years has been supporting patients with allergies, asthma, and related conditions to improve care and quality of life for them. We run several different initiatives to accomplish and keep our mission running forward. And one of those latest initiatives is the Asthma Equity Explorer database. We launched the beta version of our database in late January, And it has been so exciting to see people from across different industries, such as the Tennessee State Department of Health, that is interested in using it. So without further ado, let me jump into some details about the database. And unfortunately, since I am screen sharing, I can't see the chat or the video box, but just holler if something comes up with the slides.
Yes, I'll watch it for you. Thank you.
Mhm. The database server access is through a quick registration page. Registration, access, and use of the database are completely free. The registration page collects very basic information on who the user is, their organization, and how they're going to be using the database. And just a heads up, AAN's development team is continuously working to make the registration process as streamlined as possible. So you will be seeing positive changes to the sign-in process if you become a regular returning user, like we hope you will. And here is the hero of our presentation, the main database server. The database information is available at 3 different levels: state, county, and place, aka city or zip code, for all 50 states in the US. And depending on what information is available from the 7 or so sources all this data is pulled in from, there is more information available for some states compared to others, and for some levels compared to other levels. There are more than 32 different factors/variables from different categories, such as race and ethnicity, particulate matter, income, etc., that can be cross-analyzed with asthma prevalence. The database provides 4 different types of data outputs: A, a map; B, a graph; C, a table; and then D, a quick summary explanation tool. It also provides the ability for researchers and users to download any and all data that you want to further manipulate and analyze using your own statistical softwares of choice. And here are some more variable choices that you can find in the database, such as lack of healthcare access prevalence or COPD prevalence. We also have a little information button, this I button here, that provides more useful information on what source the variable is pulled in from, the definition of your selected variable, and more. This is an example for particulate matter. Now let me show some examples for Tennessee and particulate matter, since I know that a lot of people on this call work in environmental health. So these data results are for the state of Tennessee, cross-tabbed with the particulate matter variable. You can see the map, the graph, that can also be further toggled down by population density or population size, the table, and last but not the least, a quick explanation tool on the relationship between asthma prevalence, your selected variable, and your geographic selected area. So here you can see that particulate matter for Tennessee overall as a state is not significantly associated with asthma prevalence, but you will see the relationship start to change as you narrow down to further levels. Another interesting feature that might be useful for researchers is this toggle here between it, which allows you to toggle between the factor and the rank. That is data just about the selected factor that was shown on the previous slide, particulate matter, versus the rank, which averages both the asthma prevalence and the selected factor. You can find the definition of the rank as well as how it's calculated on the About page. Therefore, I just wanted to mention that it's not just the color of the map and the graphs that are changing. The data that is being presented to you is also changing. Now on this slide, we narrow down further to county level data using Chester County in Tennessee as our example. And here at this level, you'll see that the relationship between asthma prevalence and particulate matter start to change. We see a positive and a strong association between particulate matter and asthma prevalence. Another neat feature, since I know we hopefully have some nurses on the call as well, and this is only available at the county and place level, is the ability to view public schools as well as FQHCs, federally qualified health centers, in your selected geographic area. On this map, you can see that there's 3 schools within the 5 census tracts available in Chester County. On this slide, we further narrow down to place level data for Knoxville in Tennessee as our example. Here also, you can see that the relationship between particulate matter and asthma prevalence is significant, as well as positive and strong. I would definitely recommend every user that accesses the database to spend a few minutes reading through the About page, because the database is so robust and has so many hidden perks and features. It's also particularly helpful if you would like to learn more about the sources that are being used in the data, links to those sources, how the information is being incorporated, information on the different factors, and as well as, of course, ways to reach us. And as you can see, the list of ideas and research that can be done with the database is limitless, because the bulk of the data is so high, which also it does result, beware that it does result in a longer loading time, because it is, it's providing so much information. But we really hope this tool will be useful for not just individual asthma research, but for addressing asthma, SDOH, and other disparities in your state and surrounding communities. And because I'm sure you all will agree that ultimately it's the aim of all of us to reach not just the state or place level population, but rather the patient level populations. And I will re-emphasize that this is the beta version of the database, and we are continuously making updates to ensure that we're offering our users the best and updated tool possible. And to wrap things up, thank you to David and Angel for reaching out to AAN for inviting me to present today. And kudos to everyone in the department for your new health data website and all the work that you've been doing. And of course, a big thank you to all of you for joining today and for listening to my quick run of the database. If we have time, I'm happy to take any questions, and I'll also add in the links to the database, AAN's website, and my email address in the chat as well. Thank you.
Thank you so much. Does anybody have any questions for me too about her website of the data? Looks really robust, so it'll be hopefully a great tool for people. Yeah, and I know David shared some links as well for the Allergy and Asthma Network. Well, if you guys have any questions, feel free. Sonal says great job at covering it. So if you guys have questions, yeah, feel free to add them in. I do want to be able to go back and let Larry, if you have time to share, if you would like to tell us. I know you shared in the chat some about air quality and particulate matter, and I think that that might go well with what Mitu just shared on some of her data.
Yeah, sure, no problem. So yeah, this is big news, and it's very recent. So just last week on February 7th, EPA announced a final rule to strengthen the national ambient air quality standards for fine particulate matter, which is PM 2.5. And so when we say strengthen, we mean they are changing the standard from 12 microgram per cubic meter on an annual average basis to 9. So changing it from 12 to 9. So lowering that standard, meaning making it more strict. And so with that change, you also have an air quality index change. So with the old standard, you had 12 as the fine particulate matter standard. So anything above 12 was moderate or yellow on the AQI. And so since they're changing that from 12 to 9, you will now see that AQI change to where anything over 9.0 is going to be moderate or yellow. And so it didn't change the upper range of moderate or yellow, and it didn't change orange. So orange is the level at which we'll issue air quality alerts. So what the end user is going to end up seeing on air now is more yellow or more moderate days. And so if someone was to track trends of yellow or moderate days, they might think, oh, Tennessee has much more yellow moderate days this year than last year. Is the air quality getting worse? And that's not necessarily the case. It's that the PM NACS was lowered from 12 to 9, and so was the yellow AQI category. So I hope I explained that well enough. But I did put that fact sheet in there with some FAQs and as the AQI breakpoints table. So, but if anybody has any questions, I can answer them now. I have a little time, but it's up to y'all.
Thank you for sharing. Yeah, and David reminded me that he actually had a little slide, so I'm glad you were able to explain. And that's good to know. I think going forward, as we do look at air quality and being able to trend it over time, that the standards are changing. So thank you. Anybody have any questions to any of our presenters? All right. Well, you guys are quiet. So at this point, I'm happy to open it up and hear from you all. And David, maybe you have some different people you'd like to ask specifically, but I know we have a lot of people on this call that are doing great work. And if you have anything coming up or anything that you're working on that you'd like to share with the rest of the group, anything pertaining asthma that you think would be helpful? Feel free to come off mute if you guys do want to share something, or you can put it in the chat.
Yeah. Yeah, feel free to share. That's something that we want to do with these calls. I'm not going to call on people today, but I know that you've already heard from Environment and Conservation with the state. You've heard from Education. We'll try to get someone from TennCare along the way and other places where asthma is connected to Tennessee state government. I know that we have people from EPA Region 4 on the call, as well as the American Lung Association, and then, of course, the Asthma Allergy Network. So we have the nonprofits covered. I know we have folks from universities who are doing research or training our doctors and nurses. So again, we want to hear from you. There we go. Awesome. Thank you. Heidi?
Hi, how are you today? Can you hear me?
Oh, yes, ma'am. Thank you.
Yes.
I was so excited about this meeting. I was hoping it was going to be in person. I'm actually in Nashville today working a conference, the Hearth Patio and Barbecue Conference in Nashville. So if you hear too much, let me know. So thank you for that. So I had Simone, one of my coworkers, here to talk about PM 2.5, but I think it has been done. Nice work. So I won't do that update. Thank you for explaining that to everybody. That was excellent. I love that presentation. I just wanted to mention a few things. We have a lot of stuff going on in EPA, but one thing that could relate to asthma is one of our we're seeking applications for new grant funding to address indoor air pollutants. And I'll put all this in the chat after because I'll talk it through and then I'll put it all in the chat. But that one, well, the deadline is March the 9th. If you haven't seen that before, we had a webinar last week and I'm sure they'll archive it and I can share with that as soon as they archive it and share that information. We're just coming off of Radon Action Month, and I just want to remind everybody to test. Please test. I talk about this every year, but I actually had radon in my own home this year, and I actually did an extended test to make sure for 8 months, and it was elevated, and I did the mitigation 2 weeks ago. And so I'm just sharing my personal story so I can remind you, you could have it and your next door neighbor may not have it. It doesn't matter. I have a ranch on a slab, so it's not a basement thing. I mean, you have to test and find out if you have it and then take action. So it wasn't bad. A nice little pipe in my daughter's bedroom closet. It makes zero noise. It was not bad at all. So make sure you test for radon. Just sharing my story. One main thing we have is our asthma community network. I hope you guys are a part of that. That's where we share, learn, and connect all of our information. Great resources. One thing that's on there now, and I will share this as well. Our next webinar that's coming up is weatherization effects on pediatric asthma. And this is an evidence from natural experience. That's going to be March the 7th from 2 to 3:30. We archive all of our webinars and we place them on Asthma Community Network. So if you haven't taken advantage of that, we also have, which is wonderful, our we have a 3-part webinar series on solving indoor environmental determinants of health in asthma. And so at your leisure, once you're on Asthma Community Network, you can have access to look at those. Those are great webinars that we have going. And I think that is all I have for now, but thank you for having me. And hopefully one of these meetings will be in face to face, and I will be able to meet everybody in person.
Thank you, Heidi, and welcome to Nashville. And David did share the Asthma Community Network website in the chat. So thank you. And then thank you, Heidi. She just shared her contact information as well. And also thanks for sharing your personal testimony about radon, lung health in general. We definitely want people to have good lung health. So any other questions or anybody have additional information to share? I know Stephanie asked in the chat, or she commented that she would love to hear the latest treatments being used for asthma. I think that'd be interesting maybe in future meetings. We do have our other meetings dates planned, but I think Heidi, did you? Oh, sorry, Heidi's still adding websites, but we can definitely address that in future meetings about treatment.
I had a comment, if I may talk.
Yes, of course.
Hi, everyone. My name is Christian Rosa Salazar. I'm one of the pediatric pulmonologists at Vanderbilt Children's Hospital, and I co-direct here the severe asthma clinic at our children's hospital. And thank you so much. This is my first time joining this meeting. I think someone from our division who's no longer with us used to meet with you. So I don't know if this is the right platform to bring this up, or if this is a topic that we can potentially discuss in the future. But I'm going to try to bring actually my concern about asthma in Tennessee. And first of all, let me start by saying that I appreciate everything you guys are doing. Excellent presentations. The platform, some of the platforms that you showed are beautiful, and our work by the school nurses cannot be more applauded than from our standpoint. We love everything you guys are doing. On the other hand, treating children with difficult to treat or severe or refractory asthma in Tennessee is becoming extremely challenging. And we have several people from our team here, and we don't have enough time from stories. But someone asked about the newest treatments for asthma. Well, in the last 2 years, we've had multiple new treatments approved, strategies approved for asthma, biologics, single maintenance therapies. And Tennessee is not keeping up in general, and I'm talking about specifically about TennCare. It's not keeping up with approving these. We are spending enormous amount of time trying to get prior authorizations. We get rejected almost all the time. We get approval, or we are told that preferred medications are medications that are not approved in children, only in adults, or are approved for COPD. So all that to say that I think if this is the right group, that it's something we need to address at some point, and whether that is talking to leaders in TennCare or talking to whoever we need to talk, something needs to be done because it's becoming a nightmare to treat a child with severe asthma in this state. Now, I have to admit, it's the same in every state that I've been, but we are 10th. I think it was shown that we are 10th and one of the highest with asthma prevalence and morbidity, so maybe we can be the first to start addressing these issues. Thank you.
Thank you. Is it Dr. Salazar? Yes, thank you
Yes,
so
yes.
much.
Mhm.
Yes, Dr. Salazar, thank you for sharing your perspective. I think that's great and very, yes. very on topic. So this is definitely a good platform to share on. And I think it sounds like your team could maybe even share more in depth on a future meeting. It sounds like you have a lot of information and experience. So thank you. I know we're getting close to the end of our meeting. If anybody else has any thoughts or questions or future topics that you would like to cover? Okay. Well, it seems as though, David, did you have anything else you wanted to share?
Same thing you were going to say is thank you everybody for
Yeah.
your time. We had over 50 participants and I learned a lot and I helped plan the meeting. So that says a lot. And if you need anything in the chat, there are lots of resources. We'll get this chat posted or the whole webinar posted online for people to review later or others to watch for the first time. And again, our information is in the chat, eep.health@tn.gov for emailing with us and tn.gov/healthyhomes to get to our asthma information and other stuff. And again, if you have thoughts, hopes, expectations for future, just let us know and we'll use that in the planning process. And again, thank you.
Yes, thank you guys so much.